So happy July. It's a beautiful summer day out here at Issaquah. I was able to round out here on this campus and saw some really amazing areas of care. So I went to the Cancer Institute over here where they do their infusion, their radiation, and the nurses that work with the physicians directly in the clinic, and saw their 14 infusion rooms, and actually was able to see and talk to the nurses about how they provide the care to their cancer patients, as well as what do they do to build resilience for themselves in an environment where some of their patients are not going to survive their illness. And one of the pictures that maybe you'll see in the video here is on their tree that they have, that they actually are putting patient initials up in memory of some of their patients that they've cared for who have since passed. So that was great to connect with those nurses. The other thing that I went to was the postpartum unit and saw what they're doing in the Issaquah campus for postpartum, and saw some of the nurses, the lactation specialists, as well as a new employee who's working in EVS and going to get her NAC degree. So just some great people that I met today, so I appreciate all their time. I want to tell you a little bit about what's going on this month. We have a couple new things that all nurses need to be aware of. We've got currently some work coming out from Medicare that has required all patient-facing staff, not just nurses, to take some education around creating a safe environment for care. So what they mean by that is they're concerned about ligature risk for our suicidal patients and patients at risk for suicide. So one of the things that I want you to know about is that there's an educational offering to meet this Medicare requirement that's going to be pushed out in HealthStream. It takes about 15 minutes to complete. You can do that while you're at work. It has the function to be able to start and stop, so you can take your education module, and then if you needed to go and do something and come back to it, that it'll just pick up where you left off. And it's really for all of us to be aware of how we reduce risk and have a safer practice environment for our patients in terms of anything that they could use as a ligature and to harm themselves. So please look for that. The other thing I want to let you know is for nurses, you know, the environment right now in healthcare is that it's more and more challenging to be reimbursed for the work that we're doing. And what we've discovered in the pharmacy area is that historically we were pharmacy was charging medications upon dispensing to the nursing department or unit. And the Providence St. Joseph Health, as well as national standards, really are to charge patients upon administration of the medication. So how does that work for nursing? So what we need you all to be thinking about is that when you are hanging an IV medication, you need to make sure that you are not just clicking on start, but you're clicking on new bag, and the function needs to say new bag, and that will actually initiate a charge so that we're reimbursed for the work that we're doing. So there'll be flyers that are coming out that I would like you to pay attention to that talk about new bag, and for the inpatient units, that's all you need to do is click on the new bag. For the outpatient or the ED areas, you need to actually do a little bit more, new bag and then the stop time, and that's all on the flyer. So look for the flyers that are coming out in your area soon. And lastly, I just want to thank the SMG side of our system with nurses. I was able to sit through one of their educational offerings recently and around opiates, and how the clinic side of things is going to be looking at pain management for their patients and some initiatives that they're rolling out. And then also the providers and the nursing staff are looking at prescribing and other things that they can educate the patients around and not overly prescribe the opiates in the provider's world there. So it was a very fascinating education around the opiate crisis in our country. And when we think about Healthcare 2.0, that's part of what we're talking about, is the inpatient, the outpatient working together to have a healthier community and healthier patients. So as they are up front doing more work with their patients around pain management that are not opiate dependent, we will then also receive patients in the hospital that aren't requiring the same amount of opiates, and also continuing that work to keep people safe and also addressing their pain. So thank you to the SMG team for letting me sit in on that in-service, and I know there'll be more to come throughout the system on opiates and our opiate crisis in the country moving forward. I think that's my message for this month. Thank you very much. 4th of July is tomorrow, so probably you'll see this after 4th of July. Hope you had a happy 4th of July and a very enjoyable summer, and I'll talk to you in August.